Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to cover part 2 of the pharmacology dissection exam. This is the famous test that I got so angry over. I decided to retire it so I can go over it with you and show you the questions and explain to you the rationales for the correct answer choice, and also go into the book and show you where these rationales are coming from. Like I said before in my previous video, guys, believe it or not, the content, the basis for your test questions are coming from the exact places that you hate to look. The tables, the diagrams, the illustrations, the figures, the charts. That's where they're coming from. I want you to think about it. Why would a test writer, put something in a text, and the same thing they put in the text, they decided to put it in an illustration or figure or a diagram or table or a nursing alert? They're repeating that information in a different format because it's important for you to know. They want you to retain that information. So I want you to keep that in mind. So guys, before we get started, as always, I'm going to ask you to like this video. You're going to love it. So just press that like button now so that you don't forget. Subscribe to my channel if you haven't done so already. Please engage in the comments. I cannot respond to everyone, but I see all of your comments, and engaging and commenting, guys, it really helps the algorithm for my channel. I'm almost at 100,000. I'm like at 99.2, so I'm almost there. I'm asking you guys to please help me get to that 100,000 mark. All right, guys, let's get started. So last time we finished up number 11. We're going to start on number 12. Let's take a look. It says, which of the following medications may be used to treat partial seizures? Select all that applies. And so, guys, how do we treat select all that applies? We treat them as true or false. A, Dilantin, absolutely true. B, valproic acid, that's your Depakine, absolutely true. C, diazepam, Valium, false. What is diazepam? That's a benzodiazepine, guys. This is anti-anxiety medication, right? Not for partial seizures. D, Tegatrol, true or false? True. How about E, Zorantin? False. Now, this was a trick question because Zorantin, this is, it is an anticonvulsant, it's an anti-epileptic, but it's not to treat partial seizures. Okay, so now let's go into the textbook. Let's see what page 405. Drugs for treating partial seizures. Make this a little bit larger. And I even underlined them. I told my students they need to know those drugs. Go back to the recording of when I taught that class. It's right there. Okay, moving on. Next, a client states that he has not taken his antipsychotic drugs for the past 2 weeks because it was causing sexual dysfunction. What is the nurse's primary concern at this time? A hypertensive crisis may occur with such abrupt withdrawal from the drug. B, significant muscle twitching may occur. C, increased fall risk. D, extrapyramidal symptoms such as pseudo-Parkinsonism are likely to occur. E, symptoms of psychosis are likely to return. So going back to here, here's what's happening. The patient stopped taking their antipsychotic drugs 2 weeks ago. What are we concerned about happening? And guys, the correct answer is this. The symptoms of psychosis are likely to return. Now, if we go back to the question, it doesn't tell us the diagnosis. Most likely patients got schizophrenia, but it doesn't tell us the diagnosis. It just says antipsychotics. Now, here's the thing, guys. There is no cure for psychosis, right? So if the patient who has been on their antipsychotic medications and they all of a sudden stop taking those antipsychotic medications because of sexual dysfunction or any of the other side effects that can happen with antipsychotics, though the psychotic state can absolutely return. What is psychosis? That's being out of touch with reality. So the patient's having hallucinations, whether they're audio hallucinations or visual hallucinations, they can come back, and that's going to be the concern. Next question. A 20-year-old man's admitted to the psychiatric unit for treatment of acute schizophrenia and is started on risperidone, Risperdal. Which client effect should the nurse assess for to determine whether the drug is having therapeutic effects? A, restless sleep, elevated mood, coping abilities. B, decreased delusional thinking, lessened auditory or visual hallucinations. C, orthostatic hypotension, reflex tachycardia and sedation. Or D, relief of anxiety and improved sleep and dietary habits. What do you guys think? And the correct answer is B, decreased delusional thinking and lessened auditory or visual hallucinations. So go back to the question. They tell us that the patient's being treated for schizophrenia. Remember, guys, schizophrenia, this is a psychotic disorder where the patient's having hallucinations. They're on Risperdal, which is an antipsychotic. So which effect should the nurse assess to determine whether the drug's being therapeutic or not? Well, we're giving an antipsychotic for a psychotic disease state. So if we want to know if the medication's working, we should see less of the psychotic manifestations, less of the hallucinations, less of the delusions. There you go right here. Decreased delusional thinking and lessened auditory or visual hallucinations. Now let's look in the textbook. Therapeutic actions and indications of the antipsychotics. The antipsychotics are indicated for schizophrenia and for manifestations of psychotic disorders, including hyperactivity, combative behavior, severe behavioral problems in children, short-term control. Some of them are also improved for the treatment of bipolar disorder. By the way, again, anything I have highlighted, I put a star next to. You guys need to know, or you see me put NCLEX next to it, that means it's been seen on NCLEX many times. So make sure you guys pause to read. Okay, moving on. A client is treated for psychosis with fluphenazine. What drug will the nurse anticipate may be given to prevent the development of acute dystonia? A, benzotropine, B, diazepine, C, haloperidol, or D, lorazepam. Now, I just want to make sure that you see what I see. Let me go ahead and highlight it for you. I'm going to pause for a second just to make sure that your eyeballs clearly see what my eyeballs clearly see. But yet still, I had 4 students choose something else. How, Sway? How? Tell me how. Now, this is an important concept. It's been seen on major exam like HESI and ATI, and that's why I put it on there. However, let me go back. So guys, after I teach, I make the exam, and I make the exam because I know what I taught. So I go over I put things on the exam that are very important that the student, is very likely to see something like that on on a test like NCLEX. But there are times where I may have a good question that they may see on NCLEX, but it wasn't in the book, but I know my students need to know it. And that's why I'll put something like this, where I put it in there on purpose. I put this right here on purpose so that next week when we go over the choices, I can explain this to them. And I can let them know, hey, yeah, you got this because it's not in the book, but it's definitely been seen on NCLEX, and you definitely need to know it. And most likely, hopefully, my students will remember that. So tell me how I put this right here, but I still had 4 students that chose something else. But I'm upset for feeling some type of way the way I did. I'm over it now, by the way, guys. I'm over it. I don't stay mad for long, but I'm just saying, come on. moving on. Number 16. Which of the following client statements indicates that the levodopa-carbidopa cinnamon is effective? A, I'm sleeping a lot more, especially during the day. B, my appetite has improved. C, I'm able to shower by myself. D, my skin doesn't itch anymore. What do you guys think? And guys, the correct answer is C, I'm able to shower by myself. So guys, this medication, the cinnamon, the levodopa-carbidopa, that's a medication that's given for Parkinson's, okay? And the big problem in Parkinson is the lack of what? Dopamine. That's very important. NCLEX expects you to know that. That's the big thing in Parkinson's. So what happens is the patients develop these symptoms, TRAP, T-R-A-P, TRAP symptoms. They have tremors, they have rigidity, they have akinesia, and they have postural instability. They're at big risk for falls. And they get to the point where it will be very difficult just for them to do ADL self-care. Right here. I'm able to shower by myself, self-care. ADLs. That's how we know the medication is effective. The patient's able to do things for themselves. Look at A. We're not giving this medication to make them sleep. Look at B. We're not giving this medication to make them eat more. Look at D. We're not giving this medication because they've got pruritus. No. This is an anti-Parkinson medication. So C is the correct answer, but don't take my word for it. Let's go look in the book. Okay, therapeutic actions, the dopaminergics, because remember, that's the problem with Parkinson's, decreased dopamine. The dopaminergics are indicated for the relief of the signs and symptoms of idiopathic Parkinson's disease. Levodopa, that's the mainstay of Parkinson's disease, precursor of dopamine, crosses, blah, blah, blah. It's telling us about the drug. Wait a second, guys. Oh, wrong page. And you'll notice I wrote this in my handwriting because NCLEX expects you to know this, and I couldn't find it in the book, but they need to know it, so I put it here. Parkinson's disease, lack of dopamine, lack of coordination is characteristic in Parkinson's disease. Rhythmic tremors develop insidiously at first. They'll have weakness. They can have bradykinesia, shuffling gaits hallmark, et cetera, et cetera. So that is Parkinson's disease. So if we're giving them an anti-Parkinson's medication, what do you think we're giving that medication for? And guys, this is where the critical thinking comes in. Sometimes, let's just say, you forgot as a student. You don't remember seeing it in the book. But the fact that you know that's the anti-Parkinson's medication, you should know that it's not any of the other choices. It would have to be the one that the patient can base for themselves. Because also, if we go back here, when it goes to nursing considerations, patient safety is a big issue. Somewhere around here, we'll see it. Safety precautions, that's a big issue for the patient. Just saying. Moving on. But what? No, before I move on, again, I want you to look at these choices again. Okay. Number 17. The client asks what can be expected from the levodopa-carbidopa cinnamon he's taken for the treatment of Parkinsonism. What is the best response by the nurse? A cure can be expected in 6 months. B, symptoms can be reduced by the ability to perform and the ability to perform ADLs can be improved. C, the disease progression will be stopped. D, symptoms will be prevented. Look at those choices for number 17. As a student, let's say when I was doing number 16, I chose the wrong answer. I chose A, I chose C, I chose A, I chose B, or I chose D, right? Let's say. Once I got to number 17, that should have told me, I chose wrong. I better go with the patients able to shower themselves, because look at these choices for number 17. We're talking about the same drug, guys. We're talking about the same medication. And we know Parkinson's disease, this is a progressive disease. As time goes on, it only gets worse. There is no cure. So look at choice A. A cure can be expected in 6 months. No, it can't. So we know that's wrong. Look at choice C. The disease progression will be stopped. Isn't that the same thing as saying there's a cure? This is a multiple choice. So only one answer can be correct. So if one is false, number 3 has to be false as well, because they're saying the same thing. There is no cure. So we know for a fact A and C is wrong. Let's go to D. Symptoms will be prevented. How? How? There's absolutely no cure. The symptoms can be managed, but there's no way it can be prevented. This is Parkinson's disease that we're talking about. So the only answer choice would be B. Symptoms can be reduced and the ability to perform ADLs improved. What are ADLs? Combing your hair, brushing your teeth, putting on your clothes, taking a shower. Okay. Keep playing with these tests. Number 18. Levodopa carbidopa is prescribed for a client with Parkinson's disease. At discharge, which of the following teaching points should the nurse include? A, monitor blood pressure every 2 hours for the first 2 weeks. B, report development of diarrhea. C, take this drug with meals. Or D, if tremors seem to worsen, take a double dose for 2 doses and then call the doctor. And guys, the correct answer is C, take this drug with meals. Here's the thing, this medication, some of the adverse effects are lots of GI irritation. When it comes to GI irritation, you teach a patient to take the drug with meals. But let's not take my word for it. Let's go look in the book. What's that, number 18? Right here. Give the drug with meals to alleviate GI irritation if GI upset is a problem. Which statements made by the wife of a client diagnosed with Parkinson's disease indicates that the teaching about the medication regimen has been effective? A, the medication will control all the symptoms of Parkinson's disease if they're taken correctly. B, the medication will provide symptom management, but the effects may not last. C, the medication will have to be taken about 6 months and then stopped. D, the medications must be tapered off when he's feeling better or he'll have a relapse. What do you guys think? And clearly, there's only one correct answer choice here. The correct answer choice, guys, is B. The medication provides symptom management, not cure, management, but effects may not last. Again, Parkinson's is a progressive disorder. Progressive means as time goes on, it only gets worse. And here's the thing, there's no cure, so the patient's going to have it. They're going to have to be on this medication. But as time goes on and they're taking this medication, the effectiveness may wear off. That's number 1. And number 2, we may start seeing those extrapyramidal side effects of the medication. And that's why when it comes to Parkinson's disease, we always start the patient at the lowest dose possible that we see therapeutic effects, because we know as time goes on, not only may it wear off, we can start seeing those adverse effects. Okay, this was number 19. Before I go in the book, let's look at the other choices. A, the medication will control all. Stop. What did I tell you about test taking skills? When you see words such as always, never, all, only, stay away from it. Stay away from that choice unless you know that you know beyond a shadow that that's your answer. Usually, guess what? It's not your answer. Just like here, it's not the answer. C, the medication will have to be taken for about 6 months and stopped. Why? There's no cure. Why would you stop this medication? Absolutely not. Choice D, the medication must be tapered off when the patient's feeling better. Guess what's going to happen? Those symptoms are going to come right back. Absolutely not. All right, let's look in the book. Oh, okay. So for number 19, I talked about it in class. There's no page number in the book. But go back to my recording. You'll hear me very clearly when I say that they're starting on the lowest dose, because after a while, it may start to wear off. And we may start to see those adverse effects. Okay. Number 20, which client diagnosed with Parkinson's disease should the nurse question administering the anticholinergic medication benztropine congentin? A, the client diagnosed with CHF. B, the client diagnosed with an MI. C, the client diagnosed with glaucoma. Or D, the client undergoing hip replacement therapy. And we're talking about cogentin, which is an anticholinergic. So which one would be a contraindication? Glaucoma. Remember the poem I taught you for the anticholinergics? Can't see, can't spit, can't pee, can't see. Blurred vision, glaucoma, hello. Can't spit, dry mouth, xerostomia. Can't pee, urinary retention. Can't, constipation. Let's not take my word for it. Let's go look in the book. Number 20. Right here. Blurred vision, photophobia. Let's look at contraindications, because it has to be in contraindications as well. Oh, sorry. Oh. Right here. There's a glare. Let me see if I can put it closer for you. Can you see that? In addition, they're contraindicated narrow angle glaucoma, GI obstruction, et cetera, et cetera. I think we'll see it even a third place in this book. Nursing consideration for the patient with anticholinergic agents. Let's see. Okay, but we don't see it a third time. All right, so they put it 2 places in the book, actually 3 places. Here's the third one right here above the nursing considerations. When it comes to anticholinergics, it's very important for you guys to know to those adverse effects and contraindications. All right, number 21. The client scheduled for bilateral adrenalectomy for Cushing's disease. Which information regarding the prescribed glucocorticoid prednisone should the nurse teach? Select all that apply. All right, guys, how do we treat select all that apply? As true or false? Let's go. A, the client short of, A, when discontinuing this medication, it must be tapered. False. Let me tell you why it's false. Let me tell you why this answer is false. Because I know as a student, you're thinking, okay, steroids, you can't stop them abruptly. It has to be tapered. That is true. But remember I told you how test writers will try to trick you? They will give you a beautiful answer choice that is absolutely true. But if it's not true for your question, it is still false. Well, Professor D, how is it not true for my question? You should taper steroids. You can't stop abruptly. And that's true. But go back to the question. That patient had a bilateral adrenalectomy. Both of those adrenal glands have been removed. What are we tapering? Are you trying to kill your patient? Because with both of those adrenal glands removed, if that patient does not get that exogenous source, guess what? They're going to die. They're not going to live long. So it's not like the patient has a condition where they're getting exogenous source for just a short amount of time. Both of the adrenal glands have been removed. They have to get an exogenous source for the rest of their lives. Until they die, they have to get that exogenous source. So what are we tapering? Do you see why A is not the correct answer? Okay. Let's look at B. Take the medication regularly. Do not skip doses. Absolutely true. True. Let's see C. Stop taking the medication if you develop a round face. You will die. You got both of your adrenal glands removed, and you need that steroid to live, right? You have to get that. So yeah, you may develop a round face. You may develop buffalo hump. Your blood sugar may increase. Your skin may start getting thin, right? Yeah, that's a possibility, but you can't stop taking that medication. So that's false. What about D? Notify your healthcare provider if you start to be thirsty all the time. True. What is one of the things I just told you that the patient may develop? Hyperglycemia. So they may start getting those signs and symptoms of hyperglycemia, such as increased thirst, in polyuria, polyphagia, polydipsia, right? So yes, a healthcare provider absolutely needs to be notified. You're not going to stop taking your medication, but they do need to be notified so that other adjustments can be made. Let me tell you something, guys. When it comes to steroid, I don't care what type of steroid we're talking about. They can cause 4 things. I think I talked to you guys about that in part 1. They mask the signs and symptoms of infection. Remember, they decrease inflammation. So you have to assess your patient a lot closer for infection, right? The second thing, they can cause ulcers. They're very hard on the stomach. They can cause a patient to get gastric ulcers. The third thing, hyperglycemia, right? It can increase your blood sugar. And what's the fourth thing? What's the fourth thing? Osteoporosis. They tend to make the bone porous and puts the patient at risk for fractures. Okay, so this one, notify the healthcare provider if you're feeling thirsty all the time. Absolutely true. And then E, wear medical alert bracelet in case of emergency. That's right. You pass out and you're on the ground and you can't communicate. We need to know that you had a bilateral adrenalectomy because most likely you need an exogenous source. What number was that? Number 21. Let's take a look in the book. Not this book. All right, so implementation and rationale for the, here, let me put it here so you can see. Right here, see what it says, nursing considerations for patients receiving glucocorticoids. They need to take it in the morning because remember, it needs to mimic what your body naturally would do and it secretes the most in the morning where you need the energy to go on throughout the day, space multiple doses throughout the day, use a minimal dose for the minimal amount of time, taper doses when discontinuing from high doses or from long-term therapy. That is not for people who's gotten both of their adrenal glands removed. If the reason you're taking this medication because you don't have any adrenal glands, there is no tapering. Think about it. You have no adrenal glands. Arrange for increased dose when the patient's under stress. I put NCLEX next to that. NCLEX expects you to know it. Make sure you guys understand it. Think about it. These steroids help you fight or flight any type of stress, whether there's physical stress, such as being sick, psychological stress. I talked about all this other stuff in part 1. Oh, sorry. So this part is a case study for a patient that's taking the steroids, things you're going to teach them. take with food. What do I have? NCLEX over here. Oh, here we go. Make sure you carry a medical alert bracelet. Let's go, because I want you to see where it talks about the hyperglycemia. And that should be an adverse effects. Here we go. Let's see, systemic. Right here, increased blood sugar. All right, last. The clients develop Cushing syndrome as a result of long-term steroid therapy. That can absolutely happen. Which assessment finding would indicate this condition? What would tell you that they've got Cushing syndrome? Would it be A, the client short of breath on exertion and has pale mucous membranes? B, the client has round face, multiple ecchymotic areas on the arm? C, the client has pink frothy sputum and jugular distension? Or D, the client has petechiae on the trunk and sclerosed veins? What do you guys think? And the correct answer is B, client has a round face and multiple ecchymotic areas on the arms. Page 595. Right here, Cushing's. By the way, NCLEX absolutely expects you to know the difference between Addison's and Cushing's, so pause to read. But here's Cushing's. Purple striae, purple abdominal striae, excuse me, hyperglycemia, moon face, swollen face, buffalo hump, obesity, etc. Pause to read. And guys, part 3 is going to be the math portion of this exam. I'm going to go over the math. I'm going to teach you how to do the nursing math. But for part 2, please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover more of, and something I've been thinking about, so let me know what you think about in the comments. I've been thinking about covering more questions, not my test questions, but just, more questions and going into the book, showing you where the answers are so you can kind of really start learning how to pick out important information out of your book. If that's something you're interested in, let me know in the comment section. If not, I just won't do it. But anyway, guys, don't forget, I have audio lessons available on my website, nexusnursinginstitute.com, and part 3 of the series coming soon. Thank you so much for watching this video, and you guys will catch me on the next video.